Hello, I am Tanuka from Spire Lab, Indian Institute of Science. Here I am going to present our paper titled Source and Vocal Tract Cues for Speech-Based Classification of Patients with Parkinson's Disease and Healthy Subjects. I'll start my presentation with a brief introduction to the source vocal tract-based modeling of speech. According to the source filter model, speech is produced by passing a source signal through a filter. The glottal or supraglottal excitation acts as the source. For voiced sounds, the source is mainly quasi-periodic with some noise components which are responsible for the naturalness of speech. In case of unvoiced sounds, the source is completely a colored noise. The source signal passes through the vocal tract which acts as a time-varying filter. As a result, the spectral characteristics of the source get modulated and speech is formed. This natural process of speech production gets affected in various disease conditions, one of those being Parkinson's disease or PD. Parkinson's disease is an incurable and progressive neurodegenerative disorder that damages the dopaminergic neurons in the brain. These neurons are responsible for producing dopamine, which is a neurotransmitter required for muscle movements. The reduced level of dopamine hampers coordinated and smooth muscular control. Muscles responsible for speech production get severely affected, leading to dysarthria. Both source and vocal tract attributes of speech are reported to get impaired. Signs like monopitch, monoloudness, low voice intensity, and reduced fundamental frequency range as observed in PD indicate the impairment of the source component. On the other hand, imprecise articulation, voice nasality, and increased acoustic noise primarily relate to vocal tract impairments. In this work, we aim to compare the source and vocal tract characteristics in PD patients and healthy subjects. We analyze how different speech cues associated with these two components of speech contribute individually and in combination toward automatic PD versus healthy control or HC classification. Several speech cues have been studied in the literature for this classification task. For example, MFCC has been used with the CNN LSTM classifier. Raw speech waveforms have been used to learn representations using CNN, and the representations are used for performing the classification using BLSTM. Representations have also been learned from spectrogram and scaleogram of speech using an autoencoder. Subsequently, classification is performed using SVM and softmax classifiers. For classification as well as severity prediction of PD, MFCC, CSD, spectral dynamics, and fundamental frequency variations have been explored together with a random forest classifier. But all these explored feature sets capture information about source and vocal tract components of speech in a combined fashion. No works exist today that explicitly study the source and vocal tract components in the context of PD versus HC classification. We aim to perform that explicit exploration. Now, before moving into the details of this work, let us first look at the dataset. All speech data used for the experiments were collected at NIMHANS Bangalore. We used 59 PD and 60 healthy subjects data. The age and gender distributions are shown in this table. The subjects had 6 different native languages: Bengali, Hindi, Kannada, Odia, Tamil, and Telugu. Dysarthria severity of the PD subjects were assessed by 5 speech language pathologists from NIMHANS following the UPDRS-3 scale. It is basically a 5-point scale where 0 indicates normal speech and 4 means unintelligible speech. The mode of the 5 severity scores was considered as the final score. The PD subjects had the final scores in the range of 0 to 2. We have used data for 3 different speech tasks: image description, diadochokinetic rate or DIDK, and spontaneous speech. In image task, the subjects were asked to give brief descriptions of images shown to them. In DIDK, the subjects had to utter a sequence of monosyllabic targets like papapa, pataka, etc. in rapid succession. And lastly, in SPON, the subjects were asked to spontaneously talk about 2 events: a place that they have recently visited and a festival they celebrate, each for 1 minute. Image and SPON tasks were performed in the subject's native language. Now let us look at the details of PD versus HC classification protocol used here. As already mentioned, here we explore source and vocal tract based cues for doing the classification. To quantify source information, fundamental frequency F0 is used. The vocal tract information without any influence of the source component is captured using voicing removed MFCC or VRMFCC, that is MFCC obtained from voicing removed speech. I'll explain more about the voicing removal procedure in the next slide. And finally, in order to capture cues from both source and vocal tract components of speech simultaneously, we use MFCC. Voicing removal process modifies the speech waveform such that any voicing information present in the signal is eliminated. It is a three-step process. In the first step, that is analysis, the input speech is decomposed into F0, spectral envelope, and aperiodicity using Wald analyzer. The second step is modification, where the obtained F0s are replaced by zeros and the aperiodicity values for all frequency bands are made once. The source is made purely noisy throughout the utterance, removing any voicing information. In the last synthesis step, the speech waveform is resynthesized by Wald synthesizer using the modified F0 and aperiodicity with unchanged spectral envelope. VRMFCC is typical MFCC computed from this voicing removed speech. So it is expected to capture mainly vocal tract cues. Here we use noise robust swipe algorithm to estimate the F0 values. Estimates for unvoiced or silence regions are set to 0. Local estimates of the first and second order derivatives of the obtained F0 contours are also included, giving rise to three-dimensional feature vectors. MFCC on the other hand is computed using the Cully toolkit. For this feature, the feature vector dimension is 39, including 13-dimensional MFCC and the first and second order differences. Both features are computed at the same frame rate of 100 Hz. We perform utterance level Z-score normalization along each feature dimension independently for both F0 and MFCC. 5 different combinations or sets of the extracted features are studied in this work. 3 sets are formed by considering F0, VRMFCC and MFCC individually. Another 2 sets are generated by fusing F0 with VRMFCC and MFCC respectively at the feature level. Each of these feature sets is classified using a CNN LSTM classifier. First, the features are chunked into 2-second segments with 1 second overlap and are fed to the CNN LSTM network. The initial 1D CNN layer of the network extracts local and time invariant patterns from these feature chunks. Then the temporal dynamics of the feature sequence is captured by the LSTM layers. The final dense layer with softmax activation provides a class decision for each chunk. During inferencing, majority voting is performed over all chunks of the test speech to obtain the final class level. Here the bottom table shows the tuned architecture parameter values for all feature sets. In all cases, we maintain similar classifier complexity in terms of the number of parameters present in the network and the number of floating point operations or flops needed by the network. Here, along with clean speech, we also work on noisy speech to understand if similar observations apply to both conditions. We take 4 different types of noise: AWGN, high frequency channel or HF noise, pink and babble noise, each at 0, 5, 10 and 20 dB SNRs. Also, we consider 2 different train test settings, matched and mismatched. In the matched case, the noise and SNR of the data used in training and testing the classifier are the same. In mismatched condition, a classifier trained with clean data is used to test both clean and noisy test samples. Now moving on to the experiments and results part. We perform all experiments in 5-fold cross-validation setup, where each fold has almost equal number of subjects from both PD and HC classes. Also, the age, gender, language, and dysarthria severity distributions are kept similar across folds. Mean and standard deviation of classification accuracy over the 5 folds are used as the evaluation metrics, and Wilcoxon signed rank test at 10% significance level is done to examine if the classification accuracies obtained for different feature sets and noise conditions are significantly different across 5 folds. Now the first question we ask is source or vocal tract. Which one between the two provides more discriminative cues for the classification? It turns out that the relative merit depends on the speech task. Here we have the accuracies obtained using F0 and VRMFCC for the 3 tasks. The blue entries correspond to the feature which outperforms the other feature at 10% significance level. In SPAWN, source cues significantly outperform vocal tract cues. The spontaneous F0 variations and intonations inherent in SPAWN task might be capturing discriminative cues which predominate the markers obtained from vocal tract information. For image task, vocal tract is observed to outperform source cues. The speech recordings for image tasks are very short in duration, around 3 to 5 seconds. So these may not be able to capture F0 variations indicative of PD, and the contribution of vocal tract cues become predominant. Lastly, for DIDK task, both source and vocal tract features achieve similar level of classification performance. This might be due to the fact that DIDK is an artificially crafted speech task and it attempts to put similar weightage to both source and vocal tract information. So we see that the relative merit is task dependent. But are the cues provided by the 2 components complementary in nature? We know that MFCC captures both source and vocal tract cues. We can see here from the second and third row of the table that accuracy drops from MFCC to VRMFCC. That is when we remove source information. When we add F0 on top of VRMFCC, that is the last row of this table, the accuracies improve over VRMFCC and become comparable to MFCC case again. We can also see that the accuracies for F0 plus VRMFCC are higher than those obtained using F0 only. So overall, we can say that the cues related to source and vocal tract components are indeed complementary in nature in all speech tasks. The next question that readily arises is MFCC has both source and vocal tract information. So what is the effect if we fuse F0 with MFCC? If you look at the third row of this table, which shows this fusion performance, you can see that it outperforms both the individual features. This indicates that the source information encoded in MFCC is different from that encoded in F0, and both these type of source cues complement each other. Also, the last two rows suggest that F0 plus MFCC outperforms F0 plus VRMFCC. Next, we analyze the effect of different types of noises on the classification performance under matched trend test settings. Here, the bars indicate average classification accuracies over 4 noise conditions. Different color correspond to different SNR values. We compare the performance of F0 MFCC and fusion of F0 and MFCC for each of the 3 speech tasks. For each feature, the red dots indicate the SNR conditions where drop in accuracy with respect to the clean case is at 10% significance level. On the other hand, for each SNR level comparing across features, the black dot indicate the feature set which outperforms the other two at 10% significance level. We can see that for image and spawn, average accuracies using all feature sets start to drop significantly with respect to the corresponding clean condition at 10 dB SNR. Whereas in DIDK, the accuracy for MFCC drops at higher SNR of 20 dB than the other two feature sets. Also, we see that in noisy conditions, fusion significantly outperforms both the individual features at all tasks and SNR conditions except for the 0 dB cases in DIDK and spawn. These mean source and vocal tract features are complementary even in the matched trend test noisy conditions. Lastly, coming to the mismatched case, plots show that fusion outperforms the individual features only in DIDK, that too except the 0 dB case. For image and spawn, F0 achieves the best performance in most SNRs. The reason behind the poor performance of fusion in these two tasks might be that the performance of MFCC is getting severely affected by noise during these two tasks. Also, significant drops in accuracy with respect to the clean conditions are observed at lower SNR for F0 than MFCC and fusion in 2 out of the 3 tasks, DIDK and spawn. Since this is the mismatched case, these observations indicate that F0 is highly robust against unseen noise and SNR conditions. Summarizing all the observations, we can conclude that depending on the speech task, different components are found to capture predominant discriminative cues, though the two components complement each other throughout all tasks. Among all the feature sets considered, the fusion of F0 and MFCC is found to attain the highest classification accuracy under both clean and matched trend test conditions. However, robustness against unseen noise is predominantly observed in the case of source features encoded in F0. So throughout the discussion, we talked about the behavior of source component in general. The experiments are restricted to F0 attribute only. Similar analysis needs to be carried out in future using other source cues like glottal flow. Another interesting future direction would be to assess the dysarthria severity using source and vocal tract cues. That's all about our paper. We would like to thank the Department of Science and Technology, Government of India for their support in this work. Thank you. If you have any questions or suggestions, please feel free to write to us at spiralab.e@isc.ac.in.